I'm Natalie Kelleher. I'm Section 7. I'm going to be administrating IV medication through Piggyback. First, I'm going to be in the nursing station. I'm going to have my MAR. I'm going to see that the doctor has ordered medication, Zosyn, 1 gram every 8 hours. I've done all my calculations. I'm going to be pulling back 0.3, putting it into the Piggyback bag, and it's going to be 4 drops a minute. Once I gather all my information, I'm going to go over the patient's history, allergies, anything I need to know that's important, and then I'm going to get my medication, make sure it's the right medication, look at the expiration date, compare it with my MAR, make sure everything's accurate. Then I'm going to perform hand hygiene, and I'm going to wipe the top off my medication with alcohol pad. I'm going to pull back my 0.3.
And I'm going to look in the patient's mirrors to make sure that they aren't occluded, they don't have assisted
And take my
surgeries or anything. They're both
Piggyback 100 ml bag. Wipe the top off with alcohol pad.
And then I'm going to say to the patient it's going to be.
And I'm going to inject the medication.
All the way back. And then you can do that. Both your head back.
I'm going to dispose this in the sharps container. I'm going to mix up my bag. And I'm going to label the back of the bag with the drug, the amount, the date, the time, expiration date, patient, room number, start time, flow rate. Then I'm going to set this aside and get my tubing.
Next, I would take my syringe.
Touch the medication.
I would ask the patient if they can speak, make sure they can swallow, make sure it's not.
I'm going to prime it.
Then I would draw back up.
Now that it went all the way through, I'm going to clamp
Send the vial.
for right now.
pH test it.
Put it to the side. Everything on my tray. Make sure I have everything. Now that I have everything, I'm going to enter the patient's room. First thing I'm going to do is I'm going to check the wristband, ask the patient name and date of birth. Then I'm going to perform hand hygiene. I'm going to apply my gloves. I'm going to check the site for any redness, swelling, infiltration. Everything looks okay. Now I'm going to clamp the primary line off. I'm going to put the Piggyback higher than my primary line.
I would aspirate again, as I just did. So ask the patient how they're doing.
I'm going to attach it below the clamp.
Remove this from section.
First, I'm going to alcohol wipe the port.
I'm going to aspirate once more. Once into their stomach.
And attach.
I'm going to pull back.
Then I'm going to open the Piggyback line.
Swishing sound. And then next,
I'm going to establish
I would get 30 milliliters
the drop rate.
of water.
Make sure it's 4 drops per minute. After I've done that, I'm going to label the tubing with the date, time, and my initials.
And this can
And make sure this is off. Make sure this is on. Everything looks good. Then I'm going to check the patient once more. look for any infiltration, redness, or swelling. Ask him if he's comfortable, if he needs anything, if he has to go to the bathroom, so on. Tell him I'll be back as soon as this runs out. And then I'm going to leave the room. And then when I come back, I'm going to do hand hygiene, apply gloves again, check the site once more, make sure everything's okay. Once the medication is finished, I am going to clamp off the medication, detach, alcohol wipe, just to be safe. Then I'm going to turn the primary line back on. Check it, make sure everything's going well. Double check the primary line to make sure that the drip is correct. And I'm going to double check the patient, ask the patient once more if he's comfortable, so on. And then when I'm finished, I'm going to record the medication I administered, how much, the drug dose, route, state the condition of the site, record volume fluid, and any problems I had, any patient teaching I've done, and that's about it. Thank you.